Chat Man Friday,
a podcast for Maine in North and West Melbourne. Chatman Friday.
Chatman Friday.
Welcome to another episode of Chatman Friday. This is again Friday, me, Syed with Usman, also with a guest with you in this episode.
Yes, it's Friday time, and we are very happy here to have Dr. Shaday, who is a very important guest that we are having here today at Chatman Friday. This is our episode number 10, so it's very interesting to have her on this episode.
Yes.
Actually, Dr. Shaday, she is a doctor at Brunswick Community Health Centre, and we are coming closer to the month of November, the month that's talking about men's health, and that's very important for us to invite her in this episode so she can talk to us about some of the few things that are affecting men's health, especially coming closer to November.
Yes.
November.
And, of course, November,
having that, of course, and she's also a community activist who is going to talk to us about some important issues like the activities that they are doing to support the different issues affecting men here.
Yeah, right. Yes.
And of course, the overall public.
Of course.
So now the floor is for Shaday. Would you like to introduce
Very
yourself,
welcome,
please?
Shaday.
Perfect. Thanks so much for having us. Super happy to be here. Thank you.
Yes, our pleasure. So Shaday, would you like to introduce yourself? Like, who is Shaday?
Yeah, well, my name's Shaday. I've been a doctor in the area for about 8 years. I spent the first part of my career working in the public hospitals, including Sunshine and Footscray, and have just been recently transitioning into community medicine. And so worked in Point Cook and now at Brunswick Community Medical Centre, but have been a long time resident of the area and very happy to be involved.
Yeah, and we are very happy to have you here.
Thank
Actually,
you.
Shaday is the name of one of my favorite singers.
Yeah, I was named after her. My family is Iranian, so they wanted something. Shaday is, an Iranian name, but Shaday was my dad's favorite singer, so it was a good compromise.
Okay, that's a good thing then.
Yeah, that's right.
Yeah.
Shaday, tell us a little bit about how interesting is working with in the health environment and working with the public. How interesting is
it's really wonderful. I think it's one of those jobs where you really feel like you've contributed something at the end of the day, and it's really meaningful. And I think particularly in Australia, where historically we've had such a big emphasis placed on universal healthcare and equitable access to healthcare, being able to work in public hospitals and in community medicine really sort of taps into that feeling. We'll talk a bit later. It's becoming more and more difficult, but certainly it's a joy to go to work every day, and I feel so lucky to be able to meet the people that I get to meet and care for our communities.
And especially that time when you help someone and they're smiling to you, they're thanking. You're helping them to be well, to be healthy. That's a big thing in the life.
Yeah, definitely. I know how difficult it is to get my family to go to the doctor, and so when I see someone coming in for the first time and maybe hasn't had some of the medical intervention that they should have had, it feels very special to be able to get involved and really set up. Once you convince one person in the family and help them, all of a sudden my sister, my cousin, my daughter, they all come in, and it's fantastic.
Yeah, that's why I'm saying doctors are like angels.
Yeah. Well, actually, and you mentioned your Iranian background. So how did your Iranian background have affected your approach towards the honorable job of being a doctor?
Yeah, well, I mean, it's cliche. Every Iranian says that medicine started in Persia and all of I think it's certainly the idea of holistic medicine is something that is very emphasized in our culture, and I found that a little bit difficult in the public hospital, where it was you had one doctor for the heart and one doctor for the lungs and and one for the kidneys. It's not sort of our understanding. So working in the community where you get to talk to someone about, you know, their family and their diet and their exercise, just everything, and have a really broad understanding of someone's mind and spirit and body is, you know, a very different type of medicine and much more familiar, I think, to our communities where we have such a good history of also, you know, treating diseases not just with a tablet, you know, with fixing the community and the family and the spirit, and really, you know, being able to improve your, you know, health through all of these ways.
Well, I always remember, you know, like my grandmother, she always have a solution for any kind
Always,
of illness that I have. You know, like I thought I have this, and she gives me something, and then gets well.
And it works most of the time.
It works. I said, well, I went to the doctor, it was not working. You just didn't give me something, and I don't know what's happening.
There was a lot of experience.
Absolutely.
So
But why community health? You know, like there is a need for doctors and physicians everywhere. But to choose to be at a community health center or in public hospitals, why did you choose that?
I mean, the most important thing was that's where my community is and my family is, and I think, you know, my mum came here as a refugee and with, you know, no money, and I think came here at a time, luckily, where she got university for free and healthcare for free, and was able to, you know, build a life for herself where I was able to, you know, become a doctor and, you know, give back in that way. And I think, you know, it's really important to recognise the history there. And the opportunity that, you know, was given to my family, and she was able to she has 5 brothers and they all came, and so my whole family, all of my cousins got, you know, university educations in Australia and now professionals, and that's because of, you know, the priority that Australia placed at the time on welfare and health and education. And so I think it would be irresponsible of me not to try and give some of that back to the next generation of people coming.
It is a great thing. We all given here got some good opportunities to continue our studies and try to serve the community in our own way.
That's right. So Shaday, I really want to ask about those health issues the main have at the moment in North and West Melbourne. So you are working around these areas too. So it's easy for you to recognize what kind of like issues they have here.
Absolutely. So, I mean, the most important thing, I think, is going to your GP and going not just when you're sick, but going for screening. Because I think one of the big problems with everybody, but with men in particular, is, you know, leaving things until there's a big problem before going to their doctor.
It's very common.
I'm fine. I'm always
absolutely. I'm fine. And even then, not thinking 5-10 years in advance. You know, we want to we don't want to wait until there's a problem. We want to keep people well. And so I think screening is very important. You know, it's one of those things where you go in, and we recommend every year, for example, to have a heart health check. And in that appointment, we'll look at your blood pressure, look at your cholesterol, all of these problems that might not be causing you any issues now, and we hope are not causing you any issues now, but are problems where we can minimize risk and talk about risk before you need medication, you know, hopefully early enough to just improve diet and exercise, but then, you know, later on, improving the risk factors, cholesterol, blood pressure, and then later on treating. So we're really looking 5, 10, 15 years in advance at your heart before, you know, all of a sudden there's a big problem and you need medication, you need surgery, you need specialists. this is similar for a lot of issues. We want prostate cancer screening. We don't want to wait until diagnosis. We want testicular cancer screening. We want diabetes screening. We want people to be coming in early for some of these problems.
How would I know, like, if I have a prostate cancer?
You come in and we have screening.
So just come and ask.
Everybody, even if tonight, if you're feeling well, if you're on no medications, please at least once a year go to your doctor.
Yeah.
So are there any symptoms? Anything like that?
No.
So,
symptoms. I mean, yes, there are symptoms, and so certainly if you're having symptoms, for example, if you're having any issues going to the bathroom with your, waterworks, if you're waking up at night going to the bathroom, if you're having pain, and then, later on, if you're finding that you're getting frequent infections, if you're losing weight, anything is abnormal, we want you to come in, but we want you to come in earlier. When you're well, before there's a problem, please come. Or you don't have to come to the doctor 20 times a year. Once a year is good. Then we can do a lot in that time.
We have a short break at the moment. I know it's very interesting to continue. We may have other questions too. Maybe Osman has more questions.
I have a lot of questions. She came to the medical thing and I have a lot of questions.
Yeah, of course. Let's continue after a short break. We will come back and join the show.
Thank you very much. Yeah, let's go for a break.
Yeah.
This is North and West Melbourne Neighbourhood Centre, and we host programs and activities for locals. Visit us at nwmnc.org.au or call us at 9328 1126, or even better, come in person at 58 Errol Street, North Melbourne.
Yes, and we are back from the break, and we are very happy to have here Dr. Shaday, and she's giving us a lot of information about what we can do. And actually, we are now, imagine we are in the second half of the first half of November, which is October, we're coming to November, which is like, what, this weekend?
Yes.
This weekend is November, and it's actually November is the month to recognize men's health.
Right, yes.
And it's for many people it's called Movember. It's like, like many men, you can see them try to grow their mustache. And I don't know why they are trying to grow a mustache. Is it like related to men's health?
Well, yeah, I think like we were touching on before, I think it's one of those things that we have to do better as a community, and really taking care of the men that can be left to fall through the gaps a little bit, particularly with health. I think, we touched on some of the screening issues before, but I also wanted to talk briefly about mental health. I think that's something
also very important.
That's really important, and is something that we don't sort of fixate on enough when, discussing the health of individuals, but communities, and in particular men. I think it's an important time to recognise, I think, in November, to look at the people around you, look at, your fathers, your brothers, all the friends in your life, and really touch base and check in and focus on sort of some of the things that might be going on, not only with their physical health, but their mental health, and encouraging them to be more vocal and accessing services that are here to, help.
That's right. I have my appointment with my GP next week.
Fantastic.
It will be in November.
Remember
but I
to
didn't
do the
know.
checks.
Yeah, but I didn't know it was accident. Yeah, I don't know about November.
Well, what do you think that Said should ask the GP in order to remember his health? Yeah, so he has an appointment.
I'm hoping just for screening. Yeah.
Of course, yeah, that's it. Top to toe. Let's tune up the engines, please. Let's make sure everything is good.
But some of the sessions are very, very short. Like for 15 minutes or 20 minutes. Sometimes we can't explain everything.
Absolutely.
But at least they can understand like the important points.
Yeah. I certainly think community health is unfortunately been sort of declining over the last few generations, really, certainly sort of the last 20 years, because when I was growing up, all of the appointments that I had with my primary care practitioner was bulk billed, and I think now a lot of people are in a situation where financial pressure means that they're not going to see their doctor. I think there was a report out last year where about 8% of Australians listed primarily finances as a reason not to go to their doctor. But certainly for screening, if people aren't going to their doctor when something is wrong, making the argument to go when you feel well is much more difficult. So certainly that's a big area of my work and focus, is to try and improve community healthcare. So people aren't in the position to think, okay, well, I only have 15 minutes, I can only go once. People should be going to their doctor for half an hour, 40 minutes, a couple of times, as long as it takes. And they should have equal access, no matter where they're from and their financial position. It's a really important issue.
It could be very I don't know, it could be a lot of pressure also on GPs. And that's why, when you think about community health services, I don't know, what kind of support that we can give, especially that we are hearing in the news that there are some of the important community health services are closing down.
Yeah, I'm really glad you asked. I think what you're referencing are obviously the co-health closures. So there are 3 co-health centres that will be losing their GP practices, Kensington, Collingwood and Fitzroy. And the whole of the Collingwood co-health is closing. So not only their GP, their medical practice, but also their allied health, their pharmacy, which does the methadone program, sort of opiate replacement, but also their counselling services, speaking of mental health, are all closing. I think it's really important that we band together as a community to fight against these cuts. There's a protest on November 8 at 2 p.m. That I'm going to and I'm speaking at, and a lot of other people are going to that too. Steve Jolly, the Mayor of Melbourne, is speaking at that. We have residents of our housing towers, who are coming and speaking at that.
Which are in North Melbourne and
Melbourne, but also Flemington and Kensington.
Many of them are from refugee background,
absolutely.
actually.
And I think it's one of those things that is an absolute red line for me personally, but I think for most of the community, certainly everybody I've spoken to about this issue is on our side with it, because people recognise how important it is for everyone in our community to have access to healthcare, but also recognise the implications, like you said, of not going to a GP. GPs are the most cost-effective part of the medical system. They pick things up the earliest. If you don't have a GP, you end up in the emergency departments. The emergency departments are much more expensive. You're waiting for 12 hours. It's got much more pressure on the overall health system. They also won't do a lot of the things that we've been talking about. They're going to make sure that you're not in crisis, but they're not having that perspective of looking at that 5-10 year trajectory and not looking at preventative. That's not their role. And so I think, it's for the communities. There have been meetings. There was a 500-person meeting last Friday at Fitzroy, and I think 250 at Kensington on the Saturday last weekend came to speak about some of those issues. And I was so lucky to meet so many wonderful community members who are hopefully coming to the rally and speaking and really voicing their opposition to what's going on, because I really don't think it's acceptable.
Thanks for those people. They are participating in the rally. They are very
And what are the key services that these community health services are providing?
So I mean, the lots of services. I mean, certainly there's drug and alcohol services linked in. There are counselling services, like we've spoken about, allied health, so dental, physiotherapy, occupational therapy, lots of home help and district nursing services to try and keep people in their homes homes and out of hospitals, as well as, social programs to stop, people from being really isolated, people that come from, non-English speaking refugee backgrounds. Older people have these community programs. There are financial advice programs run through there, for people who have either problems, gambling problems, but even just newly arrived people that don't understand the system, social work. They're really fundamental, not only to health, but well-being. We're talking about the holistic importance and how important it is to be able to access, schooling, to be access, the supports that are available to you. If you don't know about them, if you can't navigate the system, it's useless.
I know some of the families, especially during the Corona time.
Of course, yeah.
I think that the role that these community health services have played to support the mental health as well as the health issues, especially with the closure of these buildings at certain time. Those community health played a very important role at that time.
Dr. Shaday, what do you think? How many people will affect by closing 3 centers, you said, right?
So 12,000 patients will be losing access to their doctor. So
average 400 each.
So I mean, they're different sizes, and I think they're one service, and they all sort of flow from place to place. But about 12,000 patients, and I know a lot. And for a lot of those patients, there will be nowhere to go. Certainly, I think our clinic has closed its book, is already at capacity, even before these closures. People can be waiting 2 or 3 weeks to see their doctor already, with these services up and running. And so I think,
if add more,
12,000 patients, finding another GP at all, let alone another bulk billing GP, is going to be very difficult.
Very difficult,
And then, what's going to happen to the technical staff who were there already, like doctors, nurses?
Well, they'll be losing their jobs. So a lot of these staff members are going to be losing their jobs. And I think, there aren't a lot of jobs in the community sector that will be able to absorb them. Some will be able to find jobs, but it's a pretty devastating loss. A lot of them, I think, have spent their lives and careers really dedicated to the communities, but are going to be in the position where they have to find employment, privately or in different sectors, and won't be able to sort of maintain that service. I think really devastating for them, but also super devastating for the communities.
What's the reason behind that? What they are saying with the government? What they are saying?
It's a bit of a complex issue and also very simple at the same time. I think fundamentally the problem is money. I think over the last 2 decades, both the federal and state governments and both Labor and Liberal have been cutting masses of funding to the health system as a whole, but in particular to community medicine and to general practice and primary care. Hospitals are certainly not funded well, but they have a lot more of the funding via the states than community health centres, which has had all of these sort of federal cuts. They have introduced, this Labor government was elected on the promise of 90% of GPs are going to be bulk billed. But certainly looking at the proposal, the bulk billing incentive program, it's nowhere near enough to be able to maintain services equally to the community, let alone have anywhere close to 90% bulk billing.
Thank you, Doctor. Let's continue the talks after another break. We have another break, so we will come back and we will have a couple of more minutes to continue.
Perfect.
Thank you.
Thank you.
Sing Now Community Choir. Join music director Susie Kelly in this inclusive community choir for adults of all ages. The choir sings music from across the world and spanning many decades. No previous experience is required. For more info, call us at 9328 1126 or visit our website.
Very welcome back to Chatman Friday. Me, Syed and Usman with you, with Dr. Shaday. A couple of more minutes with you.
Well, it's again Dr. Shaday, and we are very happy to have you here with us.
Thank you.
Well, it's a great pleasure. And let's talk about the community. And how do you feel the community should or can help?
Well, I mean, people have been absolutely wonderful so far in really sort of stepping up and, coming to these meetings and voicing not only their opposition to the cuts, but also their love and support for the community. Certainly, I think the next big thing to do would be to come to the rally on November 8th at 2 p.m. I think a really big turnout of that is really important. But also, there are petitions going around. There are, community meetings that it would be really wonderful to go to. People are phoning up their MPs and writing letters to MPs, which I think are wonderful. But broadly, from my position, we've been involving a lot of the health unions in this fight back. So the nursing union and the health services union. So I think any community members that are a part of their unions, and certainly I'm going to be feeling the widespread effects of these general cuts to the community, should try and get involved in that aspect and see what's been going on and, what they can be doing as a part of a broader organisation to maximise their impact.
And what about men health? So how can men be more participating in such issues that might be affecting their health, especially in the area here?
Yeah. Well, I mean, I think one of the main things, one of the starting points to health and well-being is just engage with your community. I think this podcast is so wonderful. And I think if anyone is feeling vulnerable or that they, have some improvements to be made, really connecting with the community around them and giving back and, organising, even if it's not around these co-health closures and politically, but getting involved with the people around them, I think is one of the first steps to really feeling that connection and improving not only your health, but the health of the community. And also go to your GP, please, for screening.
What will be the next steps after the rally? What you going to do more? Do you more activities?
Yeah, absolutely. And so keep posted. So I'm part of Victorian Socialists. It's because I think that the advocacy needs to extend beyond just these imminent closures. I think my sort of passion and priority is to improve community health and improve public health care long term. I think these 3 GP clinics are really important to keep open, but broadly we need to reinvest in our public health system. And so the way that I do that is through organising through Victorian Socialists, and we have lots and lots of events coming up. But I think the big next step is that rally next week on November 8th.
That's very important.
And a question that came to me regarding those men who are affected by homelessness, like rough sleepers and others, who might be really benefiting from the different services existing, including community health services. What should they do?
It's really tough. There's obviously there are services like Vincent Care and housing services that work in the area. If you're unsure as to what services exist, I think community health centres are still open, so you should try and get in when you can and start accessing resources if you can, and have some assistance in navigating the system, because it can be very, very difficult. But I'm sure, there are lots of ways to access some of these housing services, but certainly I think it's very tough, and I have a lot of sympathy for the position that a lot of members of our community find themselves in. So I'm hoping, with increased funding to community organisations like yours and like mine, we can start providing a little bit more help.
That's really impressive, and I think that by that we can ask everyone to check with their case managers and see how the best way that they can find the way of reaching out their health service and go to your GP.
Yes.
Do your medical checks. We are coming to November. I wish you all the health.
Yes,
And wish all of the men and those the members, the community members of North and West Melbourne, all the health. And thank you very much, Dr. Shaday, for being with us.
Thanks so much for having me.
Thank you very much. So this was this week's Chatman Friday, and until next week, we will be back with you with another fresh episode and another guest. Thank you.
Thank you very much. Chat Man Friday,
A podcast for Maine in North and West Melbourne.